day, everyone. My name is Hadil Zainal, a student nurse from Davao Doctors College. So today I'm going to perform the skin assessment, return demonstration. Skin assessment should include an actual observation of entire body surface, including all wounds, inspection of hair, nails, skin folds, and web spaces on the hand and feet, systematically from head to toe. So prior to perform the assessment, first we need to check the client's medical record if around and prepare the necessary equipment. And the equipment needed are, of course, the alcohol to sanitize our hand, the pen light for the better visualization, centimeter ruler for the exact measurement, of course, the sterile gloves to protect our hands from the client, and the plaster and gauze for, this is for the lesion of the patient. And always remember to perform hand washing before doing the assessment. Good morning, ma'am. May I in? First, you need to ask the patient consent before entering the room. Good morning, ma'am. My name is Hadil Zainal, your student nurse for today. May I see your wisdom, please? Alright. So, please state your complete name.
My name is Haria Kabuya.
Alright. Your age, please?
I'm 17 years old.
When is your birthday?
June 12, 2004.
Alright. So, what would you like me to call you?
Just call me Haria.
Alright. So, Miss Hyria, so today I'm going to assess your skin, your hair, and your nails. So, what is the purpose of this assessment? So, the purpose of this assessment is it give you important information about your general condition, and also I will inspect and palpate your skin and document your findings to the doctor to refer you to the physician and dermatologist to help you about your concern. And also, I have some question here to be answered. Is it clear? Do you have any question or clarification?
No.
Alright, so as you can see, I closed all the curtains to provide your privacy and confidentiality. Do you feel comfortable right now?
Yes.
Alright, so now, are you currently experiencing any skin problems or such as rashes, lesion, dryness, oiliness, or hyperpigmentation?
No.
Alright. So, do you have birthmark or moles?
No.
Okay. Do you have any body piercing or tattoos?
No.
Okay. Do you have any allergy to the food and medication?
I don't think so, but no.
Alright. So, has anyone in your family had recent illness, like rashes or other skin problems or allergies?
No.
So, are you using skincare product now? Do you use lotions, bleaching soap, or kojic soap?
Yes.
Okay, what product do you use?
Skin touch.
Okay, how long do you use the product?
I think it's 1 month already.
That product, is it irritating or mild to your skin?
No, I love it.
Alright, so have you had any extremely exposure to the sun?
No.
Alright, so thank you for that. So So now let's proceed to the inspecting of hair for the general color and condition, and also check for the depression of the skull. Now separate the hair at least 1/2 interval from the skull. Inspect and palpate for the cleanliness, dryness, oiliness, lesions, and parasites. Okay, and also look for the unusual growth of on the body. Okay, so to my patient, her scalp is clean and dry, and no scar, dandruff may be visible, and also the hair is smooth and firm. And also, the amount of the thermal hair cover the scalp, and pubic areas are in the normal gender distribution. So now let's proceed to the inspection of the grooming and the cleanliness of the nail. But before that, I will remove my gloves. I will inspect the nails and look for any clubbing, lesions, and cyanosis. Alright. So as I observe to my patient, her nails is clean and well manicured. And now need to palpate her nails to assess the textures and consistency. So her nails are smooth and firm. So now I need to test the capillary feel of the nail bed of my patient. To test the capillary feel, I need to press the nail briefly and watch for the color if changed. Alright. So as I observe, the pink tone returns in immediately to blanch nail bed when the pressure is being released. Alright. So now let's proceed to the color and skin integrity. Now I am going to inspect the color variation and such as the redness, the pallors, cyanosis, and jaundice, etc. And note for any odor emanating from the skin. Okay, so as I observe, the skin of my patient is intact and there are no reddened areas. So now let's proceed to the moisture. I need to palpate the skin and check under the skin folds and an exposed area. Okay, so the skin surface of my patient vary from the moist to dry, depends on the area we're being assessed. So to palpate the temperature of the skin, I will use my dorsal surface of my hand to palpate the temperature like this. Okay. Alright. So the skin of my patient is normally a warm temperature. So let's proceed to the texture. To palpate the texture, I will use my palmar hand surface of the 3 middle finger, like this. Alright. So the patient's skin is smooth and even. I don't see any abnormalities to my patient. So now let's proceed to the mobility and turgor. So note the ease of which it lifts up to assess for the mobility. And to assess for the turgor, note for the speed which the skin returns into the place after being pitched or pitching, like this. Alright. So when I pitch, the skin of my patient, it easily and immediately returns to its original position. So now let's proceed to the edema and the lesion and edema. To inspect for the lesion, note for the location, distribution, arrangement, and for configuration, including its color, shape, size, and discharge if present. But in my patient case, she don't have any, as I observed, she don't have any lesion. Okay, so and for examining also a lesion if present, use a ABCDE method where is an asymmetry, irregular borders, color variation or change, diameter, and elevation. That is the method wherein used to examining lesion if present. But to my patient, she have no lesion noted. Okay. Let's proceed to the edema. Also, I don't have any edema noted to her skin. Also, if the edema was detected, inspect the edema. Use the thumb to press down on the skin to feel of the feet or the ankles to check for the edema, like this. But my patient doesn't have edema. So, because I observed that the skin of my patient is smooth and without lesion. And now, summarize the information obtained during the working phase and discuss the findings to the client. Discuss to the client the possible plan to resolve his or her health concern if present. So, ma'am, I would like to sum up all the gathered information from you. And you are Miss Hyria Cabuyao, 17 years of age. And based on the assessment that we practiced earlier, I don't have any abnormalities that I've seen. And all the findings that I've noted are in normal. Okay, by the way, the information that I've gathered to you is safely handed to the doctor. Do you have any question and clarification?
No.
Alright, so ma'am, thank you for this assessment. I am appreciating your cooperation to this assessment. Hope I'll see you soon and stay hydrated. Okay, thank you very much and thank you for watching.